What exactly is the meniscus? And why does your knee absolutely need one? It's not hard like bone, yet it's the key to shock absorption, stability, and pressure distribution. If it gets damaged, symptoms range from a dull ache to your knee locking up. In this video, we'll dive into the meniscus from an anatomical view, real structure, real biomechanics. First, let's understand what the meniscus actually is. Take a look at this model. This is the meniscus inside the knee joint. It's made of fibrocartilage, an accessory structure of the knee. In simple terms, the meniscus acts like a flexible cushion. As you can see, here's a human knee joint. The bone on top, that's the femur, your thigh bone. At the lower end of the femur, there's a white layer. Look closely, that white layer is articular cartilage. It covers the bottom of the femur. Below it is the tibia, your shin bone. The top of the tibia, just like the femur, is also covered with articular cartilage. And up here, you can see this bone, it's the patella, your kneecap. Its surface is also covered with articular cartilage. This cartilage is quite fragile. It's not as tough as the bone above it. Now, look at these three surfaces. The surfaces covered by articular cartilage are called joint surfaces. Here's the key: the femur and the tibia face each other directly. The knee is a weight-bearing joint. When you stand, all the force travels downward. From the femur to the tibia. Now imagine if there were no meniscus. The two cartilage surfaces would press directly against each other. All that pressure would go straight from bone to bone. From the femur down to the tibia. Think about it: without the meniscus, those two cartilage layers would rub together. And your knee doesn't just bend and straighten. It also rotates slightly inward and outward. Imagine without that cushion in between. Look at this: without the meniscus, the two cartilage surfaces would collide, grind against each other, and compress each other. That cartilage would wear out quickly. So, the meniscus's job is to absorb shock and act as a cushion. From this angle, it's hard to see how the meniscus relates to the two joint surfaces. So let me show you a sagittal cut from front to back. Here's the cross-section. Now we can see the relationship between the joint surfaces and the meniscus. Look at this specimen. This is the same knee, cut sagittally to reveal the inside. Let me walk you through the structures. This is the patella we saw earlier. That's the kneecap. And here's the articular cartilage on the patella's surface. Up here, this bone, look at it, is the femur. At the bottom of the femur, you see the femoral articular cartilage. Right? And below is the tibia. The tibia also has that layer of cartilage. This cartilage, look carefully, especially where the femur and tibia face each other, between those two cartilage surfaces, there's this cushion. Right here, let me circle it and zoom in a bit. See this spot? That's part of the meniscus. It acts as a cushion, a shock absorber. It keeps the articular cartilage from pressing too tightly together. And prevents friction. That's the meniscus's job. Now, to show you the full shape of the meniscus, I'll pull one bone up and the other down. Separate them. Look at this specimen. Here, the femur is lifted up, and the tibia is pulled down. Now you can see the space in between. Here's the anterior cruciate ligament and the posterior cruciate ligament. The cruciate ligaments. And these, as I mentioned earlier, is the femoral articular cartilage. Below it is the meniscus. This is the lateral meniscus, and this is the medial meniscus. So you can think of the menisci as two little cushions. They absorb shock. But that's not all they do. In most joints, you have a balance socket, fit a rounded head and a concave socket. The ball is convex, the socket is concave. But the knee? The ball is the rounded end of the femur. And the socket, the tibial surface, is almost flat. So the meniscus actually deepens that socket. See? It makes the joint more stable. Because your knee, as it bends and straightens, needs the two bones to stay aligned, not shift inward or outward. Of course, ligaments also help with that. So here's the takeaway: the meniscus has two main functions. First, shock absorption. Second, it deepens the joint socket, making the knee more stable. Next, let's cut through here, remove the ACL and PCL to get a better look at the menisci. Check out this specimen. This is the medial tibial plateau. As you can see, this is the lateral fibula. And look here on top, that's the meniscus. This is the medial meniscus. It's shaped like the letter C. See? A shape. The lateral meniscus is more like the letter O. Look, its front and back horns are close together, forming an O shape. From this view, you can see the two horns are very close. If nothing attaches to the outside, which meniscus do you think is more mobile? The lateral one. It can move forward and backward through a greater range, sliding more as the knee bends and straightens. That's how it adapts to the joint's motion. So the medial and lateral menisci have different shapes for different functions. After seeing all this, do you have a new understanding of your own meniscus? What other anatomy topics do you want me to break down? Let me know in the comments. Thanks for watching and subscribe for more real anatomy.